Hi, my name is Emily. I'm going to be doing my head to toe assessment on Julia Fry. So first, I will be starting with inspection of the skin. With the entire assessment, I'm looking at the skin color, the skin texture, the turgor, the temperature, any scars, lesions, bruising, nevi, any edema, and the temperature. I will inspect in the head, looking at the head is straight and that the head is midline and symmetric. I'll be inspecting the hair, looking at the hair color, the hair texture, the hair distribution. I'll palpate the head for any masses, any tenderness, any crepitus or indentations, any infestations or depressions. I will palpate bilateral temporal arteries for tenderness, any tenderness. Okay. Then I will move and palpate all of the lymph nodes, starting at the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, anterior cervical, posterior cervical, and supraclavicular. Then I will assess cranial nerve 5, so I will palpate over her masseter muscle while she clenches down in her jaw. Good. Then I will have her close her eyes for the sensory. Close your eyes, tell me where I'm touching.
Forehead, chin, right cheek, left cheek.
Good. Moving on to cranial nerve 7, which is symmetry. So smile real big for me. Frown. Close your eyes real tight. Raise your eyebrows. Puff air in your cheeks and perk your lips. Good. Moving on to the eyes. I'm inspecting the eyes, the eyelashes, the palpebral fissures, the sclera, and the conjunctiva. Looking at the color. Looking at if there's any drainage or discharge. I would pull down to make sure there's nothing as far as like jaundice that cannot be seen. I will inspect cranial nerve 2, I would use a Snellen chart to assess gross visual acuity. I would have the patient stand at 20 feet away and I would assess each eye individually, along with assessing peripheral and central vision of cranial nerve 2. So I'm going to have you cover your left eye and we'll cover my eye across. So tell me how many fingers you see?
2.
And how many fingers you see?
2.
Good. Same thing on the other side. How many fingers do you see?
1.
And how many do you see?
3.
Good. So cranial nerve 2 is intact. Moving to cranial nerve 3, which would be directed consensual pupillary responses to light. So I'm going to have you look straight at my nose. Shine the light in your eye. Good. And again. Good. And same thing with the other eye. Good. And again. Good. And pupils do react to light. Then I will do cranial nerve 3, the convergence and accommodation. So follow my pen light all the way in and all the way out. Good. Then I'll assess cranial nerves 3, 4, and 6, which would be the 6 cardinal fields of gaze, all the extraocular movements of the eye. So just follow my pen light. And all 6 cardinal fields of cranial nerves 3, 4, and 6 are intact. Then I would use the light to inspect the internal structures of the eye, the red reflex, and all the other eyes. So just look straight at my nose. Good. Good. And all of those structures are normal. Then I'll move to the ears. I'm inspecting the ears, looking at the ears are symmetric and that they are equal. Then I would palpate the tragus and the pinna for any masses or tenderness, and there are none. Then I will perform, I will inspect with the otoscope, looking at the internal structures of the ear, looking at the auditory canal and the tympanic membrane. Looking at the tympanic membrane, it is gray and pearly white, but there is no redness or anything noted. Good. Then I will assess cranial nerve 8. Cranial nerve 8 would be the whisper test. So I'm going to include her left ear and I'm going to whisper. Tell me what you hear.
1, 2, 3.
Good. And same thing on the other ear.
1, 2, 3.
Good. Then I'll assess for with the Weber test for lateralization. Tell me which ear you hear it in.
Both.
Good. Then the Ryan test I'll perform to make sure that air conduction is greater than bone conduction. Tell me when you no longer hear the vibration.
Now.
And when you no longer hear it.
Now.
Good. And then I would assess the same thing on the other side.
Now. Now.
And air conduction is greater than bone conduction, so cranial nerve 8 is intact. Then I would move on to the nose, looking that the nose is straight in midline, assessing nasal patency. Good. And then I will palpate the frontal and maxillary sinuses for any tenderness, and there is none. Then I would move on to the mouth, inspecting the lips, the mouth, the teeth, the gums, the tonsils, hard palate, soft palate, the uvula, the salivary glands, the buccal mucosa, looking for any redness, any ulcerations or bleeding of the gums. I will palpate for the temporal mandibular joint, so for any crepitus or subluxation, and there is none. I would also inspect cranial nerves 9 and 10. I would have you open your mouth and say ah, good, and the uvula and soft palate rise symmetrically with phonation, and then I would elicit a gag reflex and have the patient swallow. And then I would assess cranial nerve 12, which I would have her stick her tongue out, move it side to side for me. Tongue is midline with no fasciculations noted. Then I'll move on to the neck. I'm inspecting the neck, the color, the texture, the temperature, any scars, lesions, bumps, nevi, any bruising noted. I would palpate that the trachea is midline, and it is. Then I will palpate for the thyroid gland that it is equal, so swallow for me. Good, and it is no enlargement noted and no nodules noted. I would also palpate bilateral carotid arteries, and they are 2+. Then I'm going to listen with the bell of my stethoscope for any bruise. Take a deep breath and hold it. Good. Good. No bruise noted. I will also assess cranial nerve 11. Shrug your shoulders up against resistance for me. Good. Cranial nerve 11 is intact. I will move now to the posterior chest. I'm inspecting the posterior chest. I'm looking at the chest, making sure that there is no retractions, no increased breathing, looking at the color, that there is no cyanosis, that there is no retractions, that everything is symmetric. I will palpate for symmetrical chest expansion, so deep breath in and out, and there is equal rise and fall of the chest symmetrically. Then I will also palpate for any tactile fremitus, so say 99.
99.
99.
99.
Good. Then I'm going to percuss in all intercostal spaces all the way down. Good. Then I'm going to auscultate all lung fields, making sure especially that I get to all the lateral and the middle lobe, starting at the top to all lung fields, so deep breath. Okay. And the lungs are clear throughout all lung fields. Then I will also auscultate, for egophony. So say E for me.
E.
Good. And then for bronchophony, so say 99.
99.
And whisper pectorally, so say 1, 2, or whisper 1, 2, 3.
1, 2.
Good. And I would auscultate in all lung fields as well, especially on the lateral sides, not forgetting those. Then I will move to the anterior chest, so I'll have you turn back around for me. I'm inspecting the anterior chest, looking at her work of breathing, that there's no tachypnea, no retractions, no tripod, no nasal flaring, that there is a symmetrical chest rise and fall, so I'd palpate for symmetrical chest expansion, good, and there is. Then I'd also palpate for tactile fremitus anteriorly, so 99. Good. Then I'm going to auscultate all the anterior lung fields. And lungs are clear to all lung fields. Then I'm going to move to the cardiac assessment. I'm going to listen in all 5 cardiac regions, so starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I will listen with the bell of my stethoscope for any murmurs, aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I will listen at the mitral area for the point of maximal impulse, and I'd palpate that, making sure that that is regular. and it is that I'll listen for a full minute, auscultating the rate and the rhythm, and it is 60, and the rate is regular. Then I'm gonna have that patient lie back for me. I'm going to listen again with the diaphragm on my stethoscope in all 5 regions again. So aortic, pulmonic, herbs, tricuspid, and mitral. Then I'm going to listen with the bell of my stethoscope for any murmurs. So aortic, pulmonic, herbs, tricuspid, and mitral. I would start by inspecting for any heaves or lifts. There are no heaves or lifts noted. I would palpate for any thrills, and there's no thrills noted. Then I would need to auscultate all 5 lung regions with the bell and the diaphragm. I'm also assessing for any jugular venous distension, and there is none at a 30-degree angle. Then I'll move on to the abdomen. I'm inspecting the abdomen for symmetry, inspecting the contour of it, inspecting the color of it. And then I'm going to auscultate for any bruits in the aortic artery, the renal arteries bilaterally, the iliac arteries bilaterally, and the femoral arteries bilaterally, and there are no bruits noted. Then I will listen with the diaphragm in all 4 quadrants for a full minute for bowel sounds. And I will listen if they're making sure that they're either normo-active, hypoactive, or hyperactive. Then I will percuss all 4 quadrants for tympany, resonance, or dullness. Then I will palpate for any masses or tenderness in all 4 quadrants. Then I would palpate for the liver and for the spleen, making sure that there's no enlargement noted of the liver. Then she's going to sit up. I will palpate for any CVA tenderness. So, is there any CVA tenderness? No? Good. Okay. Then I'm going to have her turn around and face me. Moving on to the extremities. For all the joints and all the extremities, I'm looking for for any swelling, any nodules, any deformities, that all the joints are symmetric, that there's no edema. I'm looking at the temperature of it, assessing the warmth of the skin, assessing for any edema and the skin integrity. So I'm going to inspect the fingers first. I'm looking at the fingers, palpating for any tenderness, crepitus, nodules, no. Assessing capillary refill. Capillary refill is less than 3. I'm going to palpate bilateral radial pulses and bilaterally 2+. I'm going to assess strength of the grips, or grip strength, 5 out of 5. Then I'm going to assess range of motion of the fingers, so flex your fingers, extend them and hyperextend them. Abduction, adduction, and thumb opposition for me. Good. Moving to the wrist, same thing with all the inspection again. Then I'm going to assess the range of motion, so flexion, extend, and hyperextend, and then radial deviation, ulnar deviation, and rotation. Good. Moving to the elbows, palpating for the elbows and inspecting for crepitus, redness, swelling, nodules, edema, heat, temperature, turgor, all that. Then I will assess the range of motion, so flexion, extension, and hyperextend. Good. Then I'll assess the bicep and tricep strength. So pull up against me and push down against me. Good. And it's 5 out of 5 for the strengths of the biceps. Moving to the shoulders, inspecting and palpating for symmetry, nodules, crepitus, deformities, pain, tenderness, anything of that sort. Then I'll assess the range of motion. So if you can extend, hyperextend, flexion, and then I want to adduct them, abduct them, circumduct, good. And then internal rotation, external rotation, good. Then I'm going to assess the shoulder strength, or strength of the shoulders, whichever. So I need you to put your arms up like this. Don't let me open, good. And don't let me close, good. Strength is 5 out of 5 on the shoulders. Then I'm going to move to light touch sensation. So close your eyes for me. Tell me where I'm touching you.
My right arm. Left arm.
Good. Then I will move to vibratory sensation of the ulnar prominence. So close your eyes and tell me where you feel the vibration.
My right wrist.
And now?
Left.
Good. Then I will move to cerebellar function. So if you will do the serial finger opposition for me, good. And then finger to finger, touch my finger, Good, and then same thing with this hand, finger to finger, good. Good, and then hand flip flop, so cerebellar function is intact. I'm also going to assess for sternogenesis and graphesthesia, so close your eyes and tell me what I put in your hand.
Pen light.
Good, so sternogenesis is intact. Graphesthesia, close your eyes and tell me what I'm drawing in your hand.
Yeah, 30.
Good, and graphesthesia is good. Then I'm going to assess reflexes, so for the brachioradial, good. And then the bicep, good. Tricep, good. Patellar, Achilles, and then Babinski, good. And then I would assess the reflexes bilaterally on the right side as well. Then I'm going to move to the lower extremities, inspecting. That's the same as I said earlier for all the joints. Any tenderness, crepitous, nodules, deformities for symmetry, any pain or anything of that note, the skin integrity, any edema, any heat present. So looking at the toes, assessing capital refill, and it is less than 3. I'm going to palpate the bilateral pedal pulses and posterior tibial pulses, and they are both 2 pluses bilaterally. Then I'm going to assess the range of motion of the toes, so flex your toes down for me, and then extend and hyperextend your toes towards you, good. Then I'm going to inspect, moving to the ankles, inspecting the ankles and palpating the ankles for any pain or crepitus. Range of motion of the ankles, so inversion and eversion, good. And then plantar flexion, and then dorsiflexion, and then rotation, good. I'm going to assess the strength of the ankles, so pull up against my hands, good, and push down, good. So strengths of the ankles are 5 out of 5. Then I'm going to move to the knees, inspecting and palpate the knees, assessing the strength of the knees, so push up against me, good, and pull down. Knee strength is 5 out of 5. I will assess the strength of the hips, so don't let me open your legs, good, and don't let me close them, good. So strength of the hips are 5 out of 5. I'm also going to inspect light touch sensation of the lower extremities, so close your eyes for me and tell me where I'm touching you.
My left shin. Right.
Good. Then I will assess the vibratory sensation of the lower extremity of the medial malleolus. So tell me where you feel the vibration at, and which ankle.
Left. Right.
Good. And vibratory sensation is intact bilaterally. Then I'm going to move on to the lower extremities. So I'm going to have you stand up for me. And then I'm going to assess the range of motion of the knees. So if you can just flex your knee for me, and then extend it and hyperextend it, good. And then same with the other knee, just flex it, extend and hyperextend, good. Then I'm going to assess the range of motion of the hips. So extension, and then flexion, and then hyperextend it, good. Circumduction, which would be, there you go. And then adduction, abduction, internal rotation, and external rotation, and we did circumduction. And then I would do the same thing on the left hip as well, good. And then I'm going to have her, I'm going to assess the spine and the range of motion of the spine. I'm palpating for any pain or tenderness, that everything is symmetric and that it is straight. So flexion, so as she's flexing, I am going to palpate for scoliosis, and her spine is straight with no scoliosis. Inflection, so extend and then hyperextend, good. And then I'm going to do lateral flexion, good. And then rotation, good. Then I will assess for the Romberg test. So close your eyes and hold out your hands in front of you. Okay, good. And then we'll have assess her gait. So walk regular for me right now, good. Regular gait is normal, and then tandem walk, good. And then hop on one foot for me. Good. And then I think I forgot to assess the range of motion of the neck. So I'm going to have you flex your neck for me, extend, hyperextend, and then rotation, and then lateral flexion. Good. And all of that is intact. And that concludes our video.